My name is Jamal Robinson, and I'm giving you a brief today on the chronic disease asthma. All right? When I was 3 years old, I was playing on the preschool playground, kickball or something, and I collapsed on the playground, and I was rushed to the hospital. My parents met me there, and I was in the hospital for 7 days, and come to find out I was diagnosed with asthma. During those 7 days, I was getting breathing treatments and IVs, different kind of drugs, and at the end of that, they prescribed me an inhaler, which was supposed to prevent further attacks and future visits to the hospital. On this diagram here, I got this from the Center for Disease Control. They're kind of old statistics, but in 2002 you can see the blue is children, ages 5 to 17, and the yellow are adults, ages 18 and over. In 2002, there were 14.7 asthma-related absentees from work or school. The 14.7 million is for the kids, the 11.8 is for the adults. And as we move on to 2003, you can see the numbers dropped, and that was just due to the increase in treatments and medicines that had came out. And since the numbers have dropped as well. Each year, over $6 billion is spent on treatments of asthma alone. With that, there are 12.5 million days of school missed between the ages of 5 and 17 per year, making it the highest absentee rate of anything. That could be sickness, if you had a cold, if you went on vacation. But asthma is the leading cause of absenteeism. Asthma is a chronic lifetime disease that attacks your lungs, and with proper knowledge, can be avoided and can be treated properly and controlled to prevent future visits to the hospital. So what I'm going to cover is what asthma is, the triggers of asthma, and some preventions and treatments of asthma. All right, what is asthma? Asthma is a chronic life-term disease that narrows the airways and constricts the lungs. If you look here on the right, you can see that's a normal functioning lung, which most people do have. Air can easily get in and out. There's no troubles breathing except for if you're exerting yourself. On this side, this is an asthma patient. Their lungs inflame, and as well as there's mucus inside the lining of the lungs, making it difficult to breathe. So if you can, just imagine breathing through a straw, somebody plugging your nose, and somebody sitting on your chest. And that's how it feels when you're having an asthma attack or asthma-like symptoms. Asthma can be both hereditary and you can get it throughout your life. You don't have to be born with it. It doesn't have to run in your family. About 70% of asthmatics do have allergies. So if you're high in allergies, you are susceptible to being diagnosed with asthma in the future. I was diagnosed with 3, but there have been people diagnosed with asthma as old as 75, 80 years old. Now that you know the definition, a little background about asthma, I'm going to move on to the triggers of asthma. All right, first we have the natural hazards, such as dust, pollen, grass, things like that. Those are natural triggers for most asthmatics. You'll notice that a lot of asthmatics tend to keep their house clean, dust-free. They might even have an air purifier so they can prevent some of those asthma symptoms. Now, some of the man-made symptoms are things such as cigarette smoke, air pollution, things like that. Cigarette smoke and pollution are easy triggers for asthma. If you're around it for too long, you can start to wheeze, you'll have that heavier breathing, and you'll want to hit your inhaler to try to cause those symptoms to go away. Also, if you are an asthmatic or have allergies, there are some contributions that affect you. If you're sick, like you have a runny nose, or you have an upper respiratory infection, those can up your symptoms for an asthma attack. So basically, when you get sick as an asthmatic, you want to try to take care of it as quickly as you can. All right, now I'm going to go over some of the long-term and short-term cares for asthma. On these pictures, you can see a child here with a doctor getting a breathing treatment. All right, whenever you have an asthma attack and you go to the hospital, you are going to get a breathing treatment, and they'll probably pump you full of fluids as well. The breathing treatments, they usually give you a series of 3, which go in 30-minute increments. And down here on the other side, that's a picture of a nebulizer. And they have different styles of nebulizers. That's just one. If you go to the hospital, you'll see some mounted on the wall with the oxygen and things with the hose coming out. But those are just 2 examples. Some of the long-term care that can be prescribed to patients is, I didn't bring it with me, but they have a disc called Advair. And Advair is a long-term inhaler. And what it does is it covers about 12 hours of the period of the day. You have to take it twice a day. So morning and night, you're taking it 8 in the morning, you're going to take it at 2000 at night, or at 8 p.m. at night. And that's just for long-term. So if you're having immediate symptoms of asthma, you don't want to hit that Advair. You want to go to a quick relief inhaler like Ventolin. Ventolin is a quick relief inhaler that most asthmatics carry with them daily. So if they start to feel the symptoms, they can take a couple pumps of their inhaler, and the symptoms should go away. All right. Now, asthma can't be cured; it can only be contained, and the symptoms can be prevented. So you can get a lung replacement, but a surgery is not really heard of. So if you have asthma, you're most likely going to live with it. You can't outgrow the symptoms, but you're always going to have that thing. It might be the allergies, it might be the pollen, the area you live in. All right, so you're always going to have asthma. It's not ever going to go away. Now, the handout I gave you right there is the asthma action plan. That's another treatment or prevention that you can use as well. If you look on the top, it's pretty self-explanatory. It's something you go through with your physician. You fill out your name, the physician's name, and you'll write your triggers, whether it's pollen, dust, exercise, things like that. And if you look over there, still on the top, the best peak flow. A peak flow meter is something that asthmatics use that judges the volume of your lung capacity. And you blow in it, the spring goes up, and it shows you a volume of air that you are blowing out with your lungs. And you want to get the best you can. All right? Now, your best is going to be your baseline according to this asthma action plan. So if you start to dip below that best, you're going to fall into the yellow and the red category. If you start to fall into the yellow and the red category, you got to take other means to get those symptoms to go away. And obviously, if you get into the red category, you need to seek immediate emergency attention. With all this information that you have now, you can see why asthma is a pretty serious illness, and it affects millions of people every day. All right, in conclusion, asthma is both a life-threatening and a life-altering disease. It attacks your lungs, it constricts your airways, and it does all kind of bad things to where you can't breathe, okay? The triggers are dust, pollen, things like that. And some of the treatments and preventions are there for you. They're afforded to you, okay? Every day, 14 people die from asthma attacks, okay? Now, there's not a lot of knowledge out there, and I'm just trying to give you a little bit of knowledge about what asthma is and how it affects people's daily lives. And that is it. Any questions?